Hi guys, I'm Dr. Will McClure. I'm an internal medicine resident, and I'm here to talk with you a little bit about monkeypox. As you're probably aware, monkeypox has been declared a global emergency by the World Health Organization. But what is monkeypox? So monkeypox is a virus that's very similar to smallpox, but usually the symptoms are less severe. The symptoms typically include fever, chills, rash, intense headache, abdominal pain, constipation in some folks. Now this rash typically can occur on the face, on the palms of the hand, the soles of the feet, as well as in the mouth and the genital region. Usually monkeypox is a self-limited disease, 2 to 4 weeks for most folks. However, there are some severe cases that last longer. How is it transmitted? Typically, human-to-human transmission occurs from close contact with an infected person as well as recently contaminated objects. Less commonly, respiratory droplets. So you think you've been exposed. What do? Call your healthcare provider. They will be able to direct you to the right lab to be able to get your test done. Typically, they'll need to swab the area, the lesions, to be able to get the best test possible. Now, once symptoms have started or you are suspected to have had monkeypox, quarantine. For those who do not require hospitalization, you can definitely quarantine at home. Be in touch with your physician about when it's safe to come out of quarantine, as all the lesions need to have resolved, the scabs need to have fallen off, as well as a fresh layer of skin needs to have formed before you can come out of quarantine. So what can you take for monkeypox? For the vast majority of cases, thankfully, supportive therapy is enough. Making sure that you're eating enough, drinking enough, particularly if you're having nausea and vomiting. For those who are severely ill or at a high risk of becoming severely ill, including immunocompromised folks, pediatric patients, pregnant and breastfeeding women, they might be considered for inpatient hospitalization as well as an antiviral medication. It's important to note that monkeypox is not a sexually transmitted infection. However, there is a higher risk of contracting monkeypox during sexual activity. While monkeypox has been found to have a greater infection rate in men who have sex with men, it's important to understand that it's not special or unique to that population and that it can be contracted and passed through any population. It is important to ask the questions, making sure that you know the folks that you're hanging around or spending time with are not symptomatic. Making sure that you're masking when appropriate, making sure that you're cleaning and sanitizing frequently used spaces. Additionally, there are some vaccines that are available. However, at this time, they're not available to the general population. So it's important to talk with your primary care provider about whether or not a vaccine would be appropriate for you. If you have any more questions, drop them in the comments, DM me, I'm here to help.